you all know, January is Cervical Cancer Awareness Month, so I thought we'll just have a pep talk on this. So as you all know, cervical cancer is one of the leading genital cancers in females in India. So there are many methods to prevent this cancer. So you all know that prevention is better than cure. So there are many ways to prevent this cancer. That's the beauty. We have, at the root level, we have something called a cervical cancer vaccination, which we give for kids as early as 13 years, that is girls. So the school girls can get vaccinated from the age of 13 years. Till 15 years, it's only the 2 doses which we give, that is at the first month and the other one is 6 months. After 15 years, it's 3 doses which we give. So these vaccines attack the virus which causes cervical cancer, that's the human papilloma virus. So after 15 years, it's 2 doses 1 month apart and the booster dose at 6th month. Usually, cervical cancer vaccination is given prior to a pregnancy or prior to a lady who is going to plan pregnancy, because the effectiveness after around 30 years is quite less. Coming to the other techniques, how we can pick up or predict cancer happening. So this test, all of you, I've already mentioned in our previous YouTube video about pap smear. So pap smear is one of the cervical cancer screening tests. So this can be done as early as 40 years and repeated every 3 years or every 5 years depending on the family history. So usually a woman is asked to screen herself for cervical cancer at least 3 times in her life. So basically at the perimenopausal age, postmenopausal and 10 years later. But in our country, as the existence of pap smear or the education of pap smear is as such low, people, at least we advise to screen themselves 1 or twice. And if they have family history of cervical cancer, it's better that you get it checked a little earlier so that we don't miss any infection. So there are 2 kinds of pap smear again. It's a conventional pap smear and the liquid based cytology. And there is something called a cervical biopsy also. So if at all your doctor has any doubts on the nature of infection or any growth, it has to be taken for examination through biopsy. There is another technique called as colposcopy, wherein the cervix is magnified under camera, which is a separate equipment wherein the different details of the cervical epithelium is scanned. So in those, we look at the features for precancerous or cancerous lesions. So at the end of this, I think some awareness has been created from our side. So kindly, if at all ladies in your house or the girls, your daughters have not been vaccinated, kindly get them and we will do the same.